So our next speaker is Magdalena Cerda. She trained in public health and social epidemiology, and she's currently the Associate Director of the Violence Prevention Research Program at the Health System of the University of California in Davis. Other places she's worked are the World Health Organization and most recently at Columbia University Department of Epidemiology. She's a renowned expert in neighborhood causes and mental health consequences of violence, and has been using systems tools to try to better understand violence prevention efforts. So thank you for coming.
Okay, thank you for coming today to this talk. Can everybody hear me? Yep. Great. So I'm going to be presenting one study within a broader program of research that we have where we're trying to use systems approaches to try to figure out optimal ways to prevent urban violence. And in our work, we're focusing on New York City. In the interest of time, I just thought I'd present one small piece of this broader program of research, but I'm happy to talk about the other work later. So I'm going to be talking about a contrast that we made between public health and criminal justice approaches to reducing urban violence. So, as I'm sure a lot of you know, violence is a very important public health problem. To give you an example, homicide is the leading cause of death for Black and Hispanic young adult males, but that is just the tip of the iceberg. For example, for every firearm-related death, we see 4 more non-fatal firearm injuries show up in the hospital. And violence is particularly an urban problem. For example, we know that homicide rates are twice as high in cities as in non-urban areas. So the question arises with this problem, and when we're thinking about how do we reimagine cities, I would argue a very important piece of that is how can we reimagine cities to reduce the problem of urban violence? So the traditional approach to reducing urban violence has been policing. And in the past few years, particularly the idea of hotspots policing has gained a lot of traction and has been implemented in cities around the country. Hotspots policing focuses the police force, reallocates the police force to focus on very small areas within neighborhoods that have the highest rates of violence. And this type of approach arises from the fact that small places within neighborhoods generate half of all criminal events. And indeed, there's promising data to support this approach. For example, a meta-analysis of randomized trials of hotspots policing interventions done in cities across the country found that places that received hotspots policing had a reduced incidence of citizen calls for services related to criminal complaints. However, in spite of the widespread implementation of hotspots policing, problems with violence persist. And so, because of this persistent problem of violence, there's been an increased call for a need for alternative solutions that go beyond the response of the criminal justice system, that go beyond hotspots policing. And so within that, there's been a particular call for public health to come in and to play a role in figuring out what might be more promising approaches for violence prevention. So I want to talk today about one such public health approach that has really gained a lot of traction lately, as evidenced by, in fact, the panel this morning where I think a couple of the commissioners talked about this model and how it was implemented in their own cities. So what I'm going to talk about is the model Cure Violence. This was an approach started in Chicago by an infectious disease epidemiologist called Gary Slutkin. And so this model treats violence like an infectious disease. And it's a community-based approach that has 2 key components that I want you to keep in mind as I go through the presentation. First of all, the model places mediators within the community. Mediators are actually people who live in the community and are former violent offenders, but who have stopped committing violence, and who live in the community, who know what's going on, who know when fights are going to break out. And so they're actually placed strategically within the community, particularly at those times when violence spikes. And so they're there to detect and interrupt violent events from happening and to stop retaliations from happening. So this is part of a short-term response to interrupt violent events. The second element is what's called outreach workers. Again, these are community members And they identify and treat youth who've been identified at high risk for violence. And they work with these youth to act as mentors and to connect them with services such as employment services and education services. So this is more of a long-term element of violence prevention within Cure Violence. So, as I said before, Cure Violence has received a lot of traction lately. Not only has it been covered in the news, but there's been widespread financial investment in this type of program. To give you an idea, the Mayor de Blasio in New York City invested almost $13 million in implementing Cure Violence within New York. It's also been implemented in Chicago, in Baltimore, and in other places. So the question arises, given the widespread attention to Cure Violence and the widespread investment in this program, how does Cure Violence compare to a more traditional violence prevention approach, such as hotspots policing? And so that's the question that we wanted to ask. And so you can imagine that actually comparing these two types of approaches with real data is very difficult. You can imagine you'd need trials of both interventions in multiple places, which would be very costly. So before doing that, we wanted to simulate what would be the comparative impact of hotspots policing versus Cure Violence on population level rates of violence. And in particular, we're looking separately at black and white rates of violence. And then we went a step further and said, well, what if we wanted to go beyond an isolated focus on one versus the other intervention? What could be the optimal combination of hotspots policing and Cure Violence to achieve the maximum reduction in violence? So those are the types of questions that we want to answer using a systems science approach. So to do so, we built an agent-based model. So to give you an idea of what an agent-based model is, if you've ever played the game SimCity, that's similar. So we basically built a synthetic city. We built a grid that simulates the city of New York, and we place agents, who are dots, within the grid, and they simulate people living within New York. We also place police and the two elements of Cure Violence, the mediators and the outreach workers, within the grid, within these virtual New York City neighborhoods. We allow agents to experience violence, and we allow police, mediators, and outreach workers to reduce the risk of violence. And then we simulate a series of different counterfactual approaches to reducing violence, focusing on hotspots policing and Cure Violence. That's a very short overview, but now I'm going to give you more details on this. So this is a schema of our model. So to give you an idea, we have agents with a certain set of socio-demographic characteristics. These agents live in neighborhoods, and they live in neighborhoods. Neighborhoods have certain demographic characteristics themselves. How we've distributed neighborhoods and given them characteristics is all based on census data. For New York City, within neighborhoods, we've placed mediators and outreach workers for Cure Violence, and we've also placed police. Agents also have friends, and so they're able to form and dissolve social ties, and agents are able to move across neighborhoods over time. Agents are also able to experience a set of behaviors. They're able to be victimized, they're able to perpetrate violence, and they're able to die from violence. And the risk of victimization and perpetration is influenced by their socio-demographic characteristics, by their neighborhood characteristics, and by their social network. The reason why we chose an agent-based model to do this kind of work is manifold. First of all, an agent-based model, as you can see, allows us to model the feedback processes that often happen in these kinds of phenomena of violence between, for example, violent behavior and choice of neighborhood, and neighborhood characteristics and violent behavior. It also allows us to model the fact that people select peers who are like them, but peers also have an influence on them. So we can model the social selection of peers, but also the social transmission of violence. Furthermore, with these kinds of simulations, we can simulate the hypothetical impact that different types of approaches, different types of doses of an approach could have on rates of violence. So that's basically what I just said. So to give you an idea of the simulated agent population, these are demographic characteristics. Each agent within our model had these demographic characteristics based on the US Census. Agents represented 5% of the New York City population, so we had the number of agents in our model represented 5%. The environment was divided into 59 neighborhoods, and so we basically created a grid that approximates New York City neighborhood sizes and locations. So the placement of each square within the grid represented the actual size and location of a New York City neighborhood. Agents were able to, as I said before, have a certain set of behaviors. So their likelihood of victimization and perpetration depended on their own history. We gave each agent a history. So it depended on their own history of violence, their peers, their friends' history of violence, agent demographics, and neighborhood characteristics. And so you might wonder, well, where did we get all this data? So in order to create this model and to calibrate all of these behaviors, we used an enormous series of different types of data sources, mostly for New York City, like, for example, 2000 census and 2010 census data, NYPD data, data from the World Longitudinal Study of New York City, and New York City Medical Examiner data. So at each step of the model, agents were able to follow a series of steps. They were able to age 1 year, to die, to move between neighborhoods, to perpetrate violence, to be victimized, and to die from victimization. So before I show you any results, I want to actually give you an idea of the dynamics behind the model. So this is a snapshot of a grid, and the dots represent agents within the model. So I want you to pay attention to two colors here. The red dots represent potential victims, and the blue dots represent potential perpetrators. And by potential, I mean agents who have a high probability of being a victim or agents who have a high probability of being a perpetrator. So how violence occurs is that if a potential perpetrator, so here you have one, a blue dot, looks within a 10-cell radius, that's this square here, for any potential victims. If there's any potential victim within this square, then that victim is attacked. So in this square, all of these red dots would be attacked. Okay, so that's the basic dynamic that we're talking about. But we can stop this in two ways. One way we can stop it is with this hotspots policing intervention. And so now I want you to pay attention to the green dots in the model. And so here, for example, there is a potential perpetrator, a police officer, and a victim. And so the police officer looks within a 2-cell radius for any potential conflicts between victims and perpetrators. A 2-cell radius is represented by this square, and if there is any such potential conflict breaking out, the police officer would stop it. So in this case here, you can see this conflict would not happen because we have a police officer. The second type of intervention is what we call the cure violence intervention. And so now we're adding these yellow squares. So these yellow squares are what we call mediators that we've placed within the grid. And these mediators stop events from happening as well. But the mediators, as opposed to the police officers who just looked within a 2-cell radius, the mediators, because they know the neighborhood more, because they live in the neighborhood, they look within a 15-cell radius for any potential conflicts between victims and perpetrators. If there are any, they stop it. And then we also have an outreach worker who identifies the 10 agents in the neighborhood with the highest probability of violence and works to reduce their risk of violence in the longer term. So that's the essence of the policing and cure violence interventions, how we've modeled them here. Before we went further to actually simulate these interventions, we wanted to make sure that we had calibrated our model well. That is, had we been able to reproduce actual published baseline rates of victimization and perpetration before we modified the model. And so what I'm showing you here is rates of victimization and perpetration according to published data. And here I'm showing you the rates according to our simulation model. And you can see that they closely match. So we calibrated the model well. So from that, we can proceed to simulate different types of interventions. And we've simulated 2 interventions. The first is hotspots policing, where we are increasing the number of police officers and redirecting them to the most violent neighborhoods. And the second is cure violence, where we're placing mediators and outreach workers in the most violent neighborhoods. So the first question is, what is the impact of hotspots policing on violent victimization? And so what you have here is on the y-axis, you have the average annual prevalence of violent victimization, and on the x-axis, you have different types of scenarios. The green bars represent black agents, the yellow bars represent white agents. And so here you have no intervention, then you have interventions for 5 years and then for 10 years. So for example, 75% increase in the police force over 5 years, and so on. So what we found is that one would have to increase the police force by 75% over 5 years in order to achieve a 5% reduction in the prevalence of victimization. To give you an idea of what this actually means, during the Giuliani years, where there was a huge increase in the police force in New York City, the police force was increased by 28%. So 75% is a huge amount, probably unfeasible. To reduce victimization by 15%, you'd have to increase the police force by 200% over 10 years. So huge increases in the police force to have a small impact on victimization. Okay, so what about cure violence? How does that compare? So here again, we have the same outcome on the y-axis, but we have different scenarios. Here we have the standard implementation of cure violence for 5 years with only one mediator and outreach worker, and then adding 2 outreach workers, 2 mediators, and then the same for 10 years. And what we find here is that standard implementation of cure violence in the most violent neighborhoods would bring about, over 5 years, would bring about a 5% reduction in victimization. So standard implementation of cure violence gives you the same effect as a 75% huge increase in policing. To get a 15% reduction in victimization, you'd have to double the number of mediators within the neighborhood. But again, a small increase in the cure violence investment would give you a 15% reduction in victimization. Again, small, but compare it to the 200% increase in the police force that would be necessary for hotspots policing to have an effect. Okay, so the last scenario that we looked at is what if we combined both? What if we combined hotspots policing and cure violence? And so that's what I'm showing you here. And so here I'm showing you in scenarios where we've combined both policing and cure violence over 5 years and over 10 years. And so what we find here is that, for example, to bring out a 5% reduction in victimization, you'd only have to increase the police force by 15%. Rather than 75%, and you could do a standard implementation of cure violence over 5 years. So that's a much smaller investment in these interventions. To bring about a 15% reduction in victimization, you'd have to increase the police force by 40% over 10 years, and have a standard implementation of cure violence. So again, a smaller investment in both policing and cure violence. When you combine the two, you can get the same effect. So this brings us to 2 main points. First of all, I think this shows that investment in these kinds of public health approaches that are community-based can actually bring about the same outcome in terms of violence prevention as a huge investment in policing. But more importantly than that, I think, is that we found that combined approaches achieve more with much fewer resources. So for example, here, just the standard implementation of the cure violence model plus a 40% increase in the police force had the same effect as doubling the cure violence investment and having a 200% increase in the police force. So I think this highlights that here, the relevant policy question isn't about criminal justice or public health, but it's really about both, and how we need to work together and bridge approaches from both fields and from other fields to bring about an effective approach to reduce violence. And the last point that I wanted to make is that, as you notice, these effects were extremely small. So this also shows that we're still missing a huge part of the puzzle about what types of approaches could be effective to reduce violence. Thank you. And I'd like to thank my collaborators.